Weekly, brought to you by KCB. KCB, making the difference.
Ahead on this week's edition, we stay with cancer, the condition that is projected to affect up to 70% of the population in developing countries like Kenya within the next 10 years unless urgent measures are taken. We bring you the complete feature after we had to cut it short last week following circumstances that are beyond our control. We apologize for that, and good evening and welcome to this edition of KTN Business Weekly. I'm Michael Oyer. For a long time, cancer has been associated with developed countries and the rich in our society. But recent studies have shown an alarming incidence of the condition as people grow older and populations adopt Western lifestyles. It is estimated that 70,000 to 80,000 new cases of cancer are diagnosed in Kenya every year. But the number is said to be much higher as the country has very few specialist doctors, just about 15 and 2 public centers that handle cancer. Our feature looks at one of the less talked about issues associated with cancer, and that's the cost of its management.
Robert Ndirangu and his wife Elizabeth are senior wardens with the Kenya Prison Service. And as they usher us into their house at the prison warden staff quarters in Machakos, there is almost a palpable warmth from this couple who have been married for over 25 years. Hospitality comes easily to them, and when we ask them to role play for the camera, they quickly forget our presence, sending us into intervals of open admiration for the two. But covered behind the smiles are fears for a very uncertain future. What will they eat? Where will they live? What happens tomorrow? Fears they face with faith and hope, all that they have for now.
Nimesikia niko na kakitu kwa matiti, wacha niende hospitali daktari aniambie.
That was a date in May last year, and when she went for a checkup, her worst fears were confirmed. She had a cancerous tumor that required urgent medical attention. That announcement sent her life on a totally different spin that if she had to live her life over the last couple of months again, she is not sure she will handle it. She is in the last stages of recovery from breast cancer, but this has had a heavy toll on her and her family. Besides the pain and distress on her body, the couple have seen the family savings wiped out in a couple of months and only hold to a very short working life ahead of them. Robert will retire this year if the government had not extended retirement age to 60 years.
Mimi na mke wangu tulikuwa tumechukua loan. Mimi nilikuwa nimechukua about 700,000. Mama alikuwa amechukua about 600,000. Tulikuwa tunaenda kujenga nyumba. Sisi tayari tumenunua mashamba yetu katika Kajiado district, na hapo ndio tuliona tutaenda kukaa.
Sasa nilikuwa nimemwaga mawe kila kitu, hata ikafanya foundation hapo. Sasa ndio kasi yangu ilisimamia hapo. Hapo ndio ugonjwa ilisikia. Wakati sasa nyumba inataka kukatwa igawe, hapo ndio ugonjwa ilisikia.
Reality of cost associated with cancer hit them at the very first meeting with a doctor before any diagnosis to investigate whether or not there were signs of the condition in Elizabeth.
Mfuko yetu tulikuwa na 5,000 kwa mfuko, 5 peke yake. Tukaenda na hospital tukapanga laini mpaka tukafikiwa. Scan hiyo tulipiswa 4,500. Scan sasa. Unaona sasa hata tikiti iko wapi sasa ya kurudi Kajiado?
Ilibidi tuone loan officer Madam Saitoti katika Kajiado Equity, na akaongea na manager wa bank, na manager akasema ikiwa ni Elizabeth na ni ugonjwa ya titi na anaenda kutolewa aongezewe pesa. Tukapewa pesa, tulipata about 100,000. Akachukua 50 na mimi nikachukua 50. So tulikibia huko tukapeana, pia haitoshi.
Basic treatment. You need 6 rounds of chemo at a minimum. If you go to the cheapest place, maybe they'll charge you 10,000, 10 to 15,000 each round. Okay, so that's 15 times 6. Then likely you'll need some surgery, so you'll be asked to pay maybe 8,000 at Kenyatta. There's radiotherapy, which most people will need. That's maybe about 60K. Then there's the medication, which you would need to take in between the cycles. There's the doctor's fee, there's the scans, and so easily say about 200,000 by the time you finish. Like, this is just basic treatment.
Doris will know, having gone through the condition herself. It had such a toll on her employer and her family that when she pulled through, she brought her friends together under the Twakutukuza Trust to try and offer solutions to the poor, counseling services, and where possible linking up poor people with the rich for financial assistance. The cost of chemotherapy, radiotherapy and drugs could run into the millions depending on the hospital and duration of treatment.
Oncology, for example, we find it's cheaper for us to take our patients from Kenya to India, pay their flight, pay for someone to accompany them, a family member to accompany them, and get them treated in India. The cost is still a fraction of what we would pay here.
In 2009, Resolution Health reports that cost of cancer overtook maternity costs, which had previously been the highest, as patients opt for cesarean deliveries. The poor then are caught between a rock and a hard place, and Elizabeth is just one of an increasing number of patients who have spent or are spending their family savings to manage a condition that doctors say is on the increase.
The times 10 number that I gave you is really from what I practice. What I used to see 5 years ago and what I see now is almost 10 times as much.
In fact, even when I was diagnosed, which was in 2005, I could count on one hand the number of people that I had heard of who had cancer. And it wasn't people who were walking around, it's people who had gotten it and passed on. But now, a few years later, it's like almost every one person in the 10 that I meet, themselves or somebody close to them, a sister, a mother, somebody, has been affected by cancer.
Cancer is one of those things that we need to talk about because it's on the rise.
Statistics on the exact prevalence of cancer in Kenya are currently not available, as the Ministry of Health has so far concentrated on major towns. A registry has been established and the government should release near exact figures on the extent of the condition before the end of the year. The World Health Organization estimates that the number of known cancer patients is about 151,000 based on those undergoing treatment at major Kenyan hospitals. Other statistics indicate that Kenya records 70 to 80,000 new cases of cancer each year, but the figure could be much higher as the country has only 2 specialized public facilities, that is Kenyatta National Hospital and the Moi Referral Hospital in Eldoret, and just about 15 cancer specialists, meaning that very many cases go undiagnosed, especially outside the 2 towns. The World Health Organization notes a major shift of the cancer burden moving from westernized developed countries to medium and low income countries as populations age and countries adapt Western lifestyles. The risk in countries such as Kenya is that with half the population living in poverty, a diagnosis of the condition is almost equivalent to a death sentence.
Wakina mama wengi hata wale tulikuwa naye hapo, wengine hata alikuwa akuji kutibiwa. Hiyo shilingi 350 ilikuwa inakosekana ya kuchomwa. Na ukikosa huwezi chomwa bila hiyo 350. Unarudi nyumbani mpaka upate. Mtu akipata 1000 analipa wiki moja.
Many times the financial constraints come into play because they can afford the treatment up to a certain level and then they say, my resources are finished, what can we do? It puts medical doctors into a very difficult position.
I'm thinking of the first 2 patients we helped. One was an elderly lady, she was in her 50s. The second one was a man who was in his 30s. For them, the reason I believe that they did not make it, they didn't make it. We tried to help them, and they did begin their treatment, and they went on with their treatment, but they didn't survive. I believe part of it was that there was a period where they did not seek treatment. Reason being, they could not afford it. I can't help wondering if it had been more readily available financially and in every other way, and if they'd been able to get the treatment that they needed earlier, whether they would have made it.
A lot needs to be done to reduce the cost of cancer medication. While treatment in public hospitals is way below that of private hospitals, it is still way out of reach for most households.